Make sure you're wearing gloves, eye protection, gown, and a surgical mask. Reverse precautions as well. Have all patients wear a surgical mask regardless of symptoms. Scene safety is what we fall back on. We have a limited supply of gowns, so we have purchased plenty of rain ponchos. I know they're not ideal, but with a limited supply of gowns, it is the best we can do at this time. They cover about 75% of your body. It's about your arms and your legs that really don't get the coverage that they should need, unless you're a short person. Other PPE guidelines that are here. When you're doing any type of patient care, you're leaning over the patient, make sure you're wearing a gown or one of those rain ponchos. The rain ponchos are disposable, single use only, and they make good as an alternative item to wear when gowns are not available. Make sure you're wearing that surgical mask. Make sure your patient has one on at all times, regardless of the complaint. And just remember, all of our hospitals want you in a surgical mask at all times, and every patient coming in a surgical mask at all times. Let's get back to these guidelines. If you are going to be performing any aerosol generating procedures, such as BVMing, ventilation and CPR, or an overdose, nebulizing a medication, any type of airway procedures, or CPAP, an N95 mask is required for you and your partner, or anybody who's in close contact with the patient, as well as eye protection, gown, gloves, basically everything. Nothing else really new here. Everything else stayed the same. Moving on. There was a new protocol released for patients at risk of COVID-19. Some of the things that I wanted to highlight here that you already know about, it's not new, but it is acceptable to allow the patient to walk to the ambulance. Utilizing the stair chair or the stretcher for a stable patient who is ambulatory places you in close proximity. So not necessary. Have them walk out to the ambulance. We want to defer any type of CPAP for the ALS providers, the advanced EMTs and paramedics. It is a BLS skill as well, but we have not fully implemented it, nor will we be. So let's hold off on CPAP at this time. At least delay it or don't initiate it. Also want to hold off on nebulized medications as well. These are high-risk procedures in the setting of a suspected COVID-19 patient or a patient with COVID-19. If you do have to do these things, whether it's CPAP or a nebulized medication, make sure you're wearing an N95 mask. When in doubt, call med control. Third thing here that I want to highlight and bring your attention to is for the paramedics. Endotracheal intubation is considered a high-risk exposure procedure. So if you can, BLS airway support is best. Supraglottic airway is okay, but try to avoid endotracheal intubation. One protocol I wanted to point out was cessation of resuscitation. Has the guidelines that all ALS skills must be successful, but a supraglottic airway is acceptable for cessation of resuscitation. So I just wanted to bring your attention to that. Also, there may be in the future, not at this time, but obtaining swab samples for COVID testing. And also, if the COVID-19 patient's refusing to go by ambulance and insists on staying home, which is fine, you can just document the refusal. You do not have to get a signature from these high-risk patients. So clearing the call without a signature is okay. We're going to get into that with the next protocol, which is brand new. That's where the big red arrow points to. Here is the COVID-19 emergency non-transport protocol. Now this is a biggie. This is a mobile integrated health or community paramedicine type situation. Now, this is brand new to all of us. It'll be brand new to you in that consider the fact that you are treating and not transporting a patient, nor are you obtaining a refusal. So everything I've told you up to this point in your career, that every patient contact requires a refusal, right? I've said it till my face was blue that if you talk to a patient in a Trinity uniform, you have to obtain a refusal. Well, not for these patients. COVID-19, under this state of emergency, it does not require a refusal. Now, you have to go through the protocol from top to bottom. And it's intended for COVID-19 patients, suspected COVID-19 patients, no other complaints. Starting at the beginning, is the patient alert and oriented to person, place, and time? Yes. Is the patient between 18 and 55 years of age? Yes. Does the patient have at least 2 symptoms of viral syndrome? Now, you want to ask those questions, your OPQRST questions, sample history, cough, sore throat, nasal congestion, fever, myalgias. If the answer is yes, check the vitals. Pulse, blood pressure, respiratory rate, and definitely oxygen saturation is important with COVID-19 patients. They have found patients that have oxygen saturations in the 70s who are super sick but didn't really look super sick. So make sure you're getting a good oxygen saturation reading. Also, when you're considering normal ranges of vital signs, consider your patient's history as well when you're talking about blood pressure and pulse rate. Then you want to go down and continue on through the protocol. Are all of the following absent? So you have to make sure that the patient with the COVID-19 symptoms, meaning the sore throat, the viral syndrome, and the vital signs that are within normal limits for their age, didn't have a syncope. But they can have chest pain with a mild cough. No cyanosis should be present. Respiratory distress should not be present, or increased effort. So you're going to have to measure the breathing, respiratory rate, and look for averages. 12 to 20 is your average for the average adult. Also, you want to make sure that they have no history of COPD, asthma, heart disease, diabetes, or immunocompromised. Otherwise, those patients should really go to the hospital. Then you have to call the doctor. So call medical control and give them the story. Ask for permission. We'll get further into the medical control on the next slide. Now, if your medical control physician says yes, you can leave the patient at home, then the patient qualifies for self-care. Self-care means they're staying home. It's not a refusal. But the patient or caregiver has to consent to not going to the ED. Yes, it sounds like a refusal. It basically is a refusal, but you don't have to get a refusal signature, nor do you have to do call a refusal. So I'll get more into that. You also have to make sure that the patient has accessible healthcare provider. So talk to them about whether they have a primary care physician or not. If they don't, just mention the fact that they could always call 911 if their symptoms worsen and they need to go up to the hospital. That's allowable as well. Now, going back to these. If at any time the answer to any of these questions is no, you head right over here and jump into the treatment protocol for which you're treating the patient under and transport them to the hospital. Sound good? Yes, we are introducing a mobile integrated health concept during a state of emergency. Mobile integrated health or community paramedicine. Yes, you are all now community paramedics. all EMTs, EMT Advanced, and paramedics are all under one umbrella called community paramedics with community paramedicine. That's what this concept comes from. Oh, I forgot about the red arrows. Anyway, next. Now, we developed a checklist for these patients. So, patient has your under suspicion for COVID-19. You've worn all your PPE. You've put reverse precautions on the patient. You're doing your interview. And the whole reason behind all of this is we want to tell the patients, look, the hospital is not the place for you to be. You're well enough to stay home, self-care, follow up with your physician. You're most likely not going to get tested at the ED tonight. You're certainly not going to get the results back within a couple of hours. So stay at home, stay away from sick people, and get better at home. That's the whole reason why we are trying to stop transporting well people to the emergency room with COVID-like symptoms. So the checklist. You're going to do this checklist every time you are under this protocol. The backside will have the protocol that we just went over on the back as reference. And this checklist here must be filled out for every patient for which there is a COVID outcome in the PCR. I'll show you that in a minute. The number for medical control is right here, and we are only getting med control out of Holy Family. New Hampshire has this as well, and for New Hampshire, online medical control is optional. That's the only difference for New Hampshire. Next, we are going to provide you with a handout. You must give this to the patient who is staying home because of COVID-19 symptoms. So we are going to have you hand these out to the patient. It's just a standard CDC form of what they should do for self-care. Next, what you're going to tell dispatch. So you're not going to clear no EMS. You're not going to clear refusal because it's not no EMS. It's not a refusal. You are treating and releasing the patient, but you are going to say over the radio, no transport, self-care. Dispatch is going to cancel out your call with the cancellation reason of MIH, Mobile Integrated Health. And then under the disposition tab, where you used to use treated and transported or refusal, you're going to choose treated, no transport, COVID with self-care. It's all one line. Choose that as your outcome. It's really important that that is chosen. It is the only way that you'll be able to close out that call because it's, like I said, not a refusal. It's not a cancellation. It's not an OEMS. It is a treated, no transport, COVID with self-care. All one line. All one thing. Med control. As a reminder, all of our Massachusetts-based ambulances obtain medical control from Holy Family Hospitals, Haverhill or Methuen campuses. I wrote campuses, but it didn't like it, so I wrote campi. More than one, I don't know. Here are the phone numbers to call. You can call either campus. New Hampshire Med Control is typically through their receiving hospital. Those that work up in New Hampshire know how to handle this. New Hampshire COVID-19 protocols. So basically, when it comes to the New Hampshire protocols, I just wanted to briefly review them because New Hampshire protocols and the Massachusetts protocols are basically the same when you're talking about signs and symptoms and risk factors, right? COVID-19 is the same in Massachusetts as it is over the border north. The PPE recommendations are the same for New Hampshire as they are in Massachusetts. Face mask, gloves, eye protection, gown. Nebulized therapies, CPAP, We want to delay or discontinue or not do it at all for these patients, just like Massachusetts. There is also a note in the New Hampshire protocol about corticosteroids, um, delaying administering steroids. These patients who are COVID-19 positive don't do well once they've been administered steroids, so let's stay away from giving them steroids IV. Steroids aren't really an emergency medication anyways, so paramedics should stay away from administering these to a COVID positive 19 patient. You also want to consider as a paramedic epi, 0.3 milligrams IM for severe asthma. It is also in the Massachusetts protocol as well for severe asthma for BLS and ALS providers. Again, that's staying away from nebulizers. Using nebulizers. Nebulizers put you at high risk for contracting COVID-19 because it aerosolizes the COVID virus. So that's why we want to stay away from nebulized therapies. So epi is an option. And I'm not talking about a mild epi exacerbation, popping them in the thigh with epi. What I'm talking about is a severe asthma or a severe bronchospasm patient. Watch your ages too. You want to be very cautious over the age of 65 with epi. Typically, it's a med control option only. And again, avoiding endotracheal intubation. It's a high-risk procedure. Use a supraglottic airway or BLS the airway. We bought bacterial filters to be distributed throughout the company for ALS and BLS providers. The bacterial filters are for bag valve masks. They're also for the ventilator circuits, for the transport ventilators for the ALS providers. And they provide coverage of the exhalation so you won't aerosolize stuff. Just cuts risk. The New Hampshire protocol for destination determination. Again, this is much like the Massachusetts protocol. New Hampshire came out first. Massachusetts came out second, so I'll give them props for that. Their protocol in New Hampshire has these blocks. Consider non-transport or an alternative destination, and then these are the patients with the symptoms that must be transported. So let's talk about that. Your patient is at home with COVID symptoms, fever, cough, exposure to a family member at home who is COVID positive. Now they're having pressure in their chest and they're confused with low blood pressure. This would fall under, in Massachusetts and New Hampshire, the must transport protocol. The patient's getting super sick, super septic. Let's go all the way up here and talk about a patient that you would consider non-transport. Maybe they have a family member who is sick at home with COVID-19, who's COVID-19 positive, and they feel feverish. They've had a cough, but no chest pain. Oxygen saturation of 98%, blood pressure is 128 over 80, heart rate's in the 80s, and respiratory rate's 12. We are going to encourage them for self-care, stay home, consider non-transport. I do want to mention this alternative destination thing. Alternative destinations are being set up at this time. They are not in use. We are going to hospitals at this time. If that changes, we will let you know. This is a pretty big protocol, but it all says the same thing as the Massachusetts one. The Massachusetts one was modeled somewhat after the New Hampshire protocol. When it comes to documenting these calls, there is a new outcome added. So, blue tab here under outcome. Starred, treat, no transport, COVID with self-care. That is how you are going to document the outcome of these calls in which patients are left home. Again, I said it was not a refusal, so you're not going to use these. It's not a no EMS. It's certainly not a treated, transported in this unit, and it's not a cancellation. What it is it's this specifically right here. You didn't get a refusal. You just left them at home with self-care because they're walkie-talkie, not sicky. Just put it very bluntly. Those are the only patients that you should be leaving home. Walkie-talkie, not sicky. You don't want to make them sicker by them going to the hospital. And this is for Mass and New Hampshire. You are using this to close out these calls. You pick any of these and you're going to have a hard time closing out your call. Next, I want to talk about the impressions. So, under the objective tab, maybe you've heard impressions. Impression is what you think in your head is going on with the patient. You can choose all of these. These are all the checked ones in blue, are all COVID-like symptoms. You don't want to check all of them for every call, of course, but check the ones that the patient tells you about. They could have fatigue, fever, flu-like symptoms, shortness of breath, respiratory distress. I'm talking about documenting any COVID call, suspected COVID call, person under suspicion for COVID. You go to document this call, make these your primary impressions. That way I can find these calls and get better data out of the system. So you can use these for all your suspected COVID calls. Signature status. So let's say I talked about earlier the fact that the COVID positive patients or the patients with suspected COVID, we did not want them touching your computer. So you have them not sign. So what you do is you choose the signature status, you sign for them, and you choose this, not sign, COVID precautions. Close it out with that. That is going to be the signature status. Please do not choose this for patients for which do not have COVID symptoms. So if you end up at one of the assisted livings for a fall, and you get there, you transport the patient, you forgot to get the patient's signature, so you sign for them, and then you choose, you go, oh gosh, which one should I choose? For the patient who fell and does not have COVID symptoms, you're not going to choose COVID precautions as the reason why you didn't get their signature. You're going to make up something else. I know you are. That's fine. Just don't choose the COVID one. Only use this COVID one for COVID suspected patients or positive patients. Thank you. Next. PPE use. I know I've been hammering a lot of you on documenting your PPE use, but getting better data out of the system makes us make better decisions on ordering inventory. So knowing how much you are using out in the field helps us to order more to make sure that you're covered. That is the bottom line. So, interventions tab, PPE use. You can put in all this. You can make choices, multiple things. It's not just one. You can keep on adding. Hit this plus box. Add more, more, more. Supply, quantity. Tell us what you put on you. Tell us what you put on the provider. Tell us if you used an N95, if you used goggles, or if you didn't use any PPE for whatever reason. Just let us know. I also do contact tracing. Contact tracing is 3 to 4 days later, the infection control department from the hospital calls me up and says, hey, on the 1st of April, you guys brought in patient so-and-so, and that patient is now positive for COVID-19. So I'm just letting you know. What I do is I go back, I look up us transporting that patient, I look at your documentation, and whether you use this PPE buttons or added it to your narrative. If you did, then I don't have to call you and tell you that you had exposure to a COVID-19 positive patient because you were protected. That is a protected exposure. No reason for me to call you and tell you. If you didn't fill this out, I would call you. I would probably put you on quarantine for 14 days and recommend that you review our PPE policy because you should have been wearing it at this point for every single call. This is kind of why we went to a personal protective equipment on every single call universally, because of all the positive COVID patients we are seeing over the last 2 weeks. Next, chief complaints. Under the subjective tab, you hit chief complaint. Again, for the suspected COVID or COVID positive patient with symptoms, choose these flu type symptoms. You can choose a lot of them. Whatever the patient's telling you, choose them. Use those as your chief complaints. They should match your primary impressions. That way we get better data out of the system. Thank you. Again, just pointing to those chief complaints. Look at this. You could put this all for one call if you wanted to. All this could be for one call. We might have gone back. Nope, we didn't go backwards. Other field impressions here. So, newly added to the PCR is COVID-19. So, if you have a COVID-19 contact with exposure or a suspected exposure, you can choose these as your primary impression. Put into the search field COV. These two pop up. Choose one or the other depending on which one applies to your current patient. So those can be your primary or secondary impressions. So maybe primary impression, I choose flu-like symptoms, and maybe secondary impression, I choose one of these for my suspected COVID or COVID contact. Next, we're going to talk a little bit about specific hospital point of entry instructions. So every hospital has a unique plan on how they want to receive your suspected COVID-19 patient. All hospitals are now requiring EMS to wear face masks at all times while in their EDs. Think about this. They're not allowing any visitors. They're not allowing outside people in. They're closing down EMS rooms. They're closing down other rooms in the hospital. They want the least amount of people in walking through the ED at any time. And those that do walk through, they want us to wear face masks. Some of them provide face masks to us. Some of them rely on us to use our own. Either way, make sure to wear a face mask when in any emergency room, either in Massachusetts or New Hampshire at this time. Early notification for isolation precautions. I don't know how important that is at this time, considering the amount of calls that we're dealing with and the fact that we are pretty much taking isolation precautions for almost everybody. But it is helpful if you strongly suspect that you're dealing with a patient with COVID-19 who's coming from a nursing home. And I say that because we are seeing clusters of the virus outbreaks at nursing homes in our areas. Remember, right now at Trinity, you work in the hardest hit counties in both New Hampshire and Massachusetts with the highest numbers. Yes, those numbers aren't very high, not like New York, of course, or San Francisco, or Seattle, or Louisiana, or Detroit, but the numbers are the highest in our states. So, our counties are the busiest. Lowell, Haverhill, and Rockingham County up in New Hampshire. We are the busiest right now, and we are seeing more of these patients. So isolation precautions, giving them the heads up. Holy Family Hospitals updates. The Holy Family Hospital Haverhill ICU closed to new patients just this past Saturday. They also closed for West, the inpatient floor. So they are not allowing COVID positive patients in there either. They basically consolidated their COVID positive patients down to Holy Family Methuen. They are either placing them in the ICU if they need ICU level care, or they're going to the patient floor up on St. Camillus. So you may see an uptick in patient transfers at the ALS interfacility and BLS interfacility level of COVID positive patients. For interfacility transfers, we are suggesting and recommending that N95 masks be donned by the crews for COVID positive patients at this time. Kearney is also an accepting hospital, as well as Morton down in southern Massachusetts for COVID positive patients for Holy Family. So you may see us called to transfer patients down there too. If in triage as notification, there is an isolation precaution button just as a reminder for those of you that are logged into triage and use it for Methuen or Haverhill. And as a reminder, when doing emergencies in Haverhill, consider 2 or 3 things when deciding on point of entry which hospital you're going to go to for patient care. Imminent airway collapse always goes to the closest hospital. But if you have a somewhat stable patient who may need ICU level care, you definitely want to jump down to Holy Family Methuen and drop your patient off there, or Lawrence General, over taking them to Holy Family Haverhill, where they're going to most definitely get transferred out because the ICU level is closed. So keep those things in mind when choosing your destination facility. If they're sick, you want to take them south. Unless they're sick and unstable, you want to go to the closest facility where they can be stabilized. Next, Lowell General COVID point of entry. So there is a transport and transition of care recommendations for 911 calls coming into Lowell General. You've already screened the patient. If you're on scene, call in your entry note. If it's a priority 3 or priority 4 patient, walkie-talkie, you want to call the inbound coordinator, because the inbound coordinator is going to make a decision on whether you're going to Lowell General main campus or Saints campus. And yes, we are 100% listening to them at this time. Your priority 1 and 2 entry notes should go to Northeast CMed, your sick patients called in through Northeast CMed. No visitors at the hospital, so don't invite them into your ambulance, and remind people who want to go that there are exceptions. Parent with a child, elder because of the healthcare proxy thing, or maybe an end of life scenario. But again, you want to recommend that we're not taking extra people in ambulances at this time because of COVID. So your COVID positive patient who's positive or suspected, on arrival at the ED, patient and 1 EMS provider remains in the ambulance or an ambulance bay. Send the driver into the ED to get a room assignment, register the patient, return to the bay. Make sure the patient is masked, which we will have already done. Then proceed to the room assigned. Do not stop at registration. Don't stop at the charge RN desk. Doff all your PPE prior to leaving the patient's room. Hand hygiene, of course, give your verbal report. Be careful of cross-contamination. We may see an uptick in transfers of patients from Saints over to the Lowell General main campus, or vice versa, both at the ALS and BLS level. And again, if we're doing these COVID positive patients or suspected COVID patients for ALS interfacility transfers, and we're going to be sitting in close proximity in a closed ambulance for an amount of time, then we want to go to an N95 mask. Exeter Hospital, just to give some brief updates about the New Hampshire hospitals. Exeter Hospital sent this email out, I think it was 2 days ago, just a few changes they were making, making sure that you are in full PPE, making sure you hit the call button. They will come out and transfer the patient over to an ER stretcher out in the bay. We are seeing this a lot more from the New Hampshire facilities. They also don't want you providing any type of nebulized medication, CPAP, or bagging without a filter. If you're doing any of those things, discontinue them. If you're bagging without a filter, they'll come out and give you one. Then you will register the patient if you have the license or ID. You can read the rest. We don't go here a lot. We go to medical center. Um, Parkland Medical Center also wants transfer of the patient in the ambulance bay as well, or between the two doors. The EMS room may be closed soon. We're finding that that is occurring in a lot of our hospitals everywhere, and they stopped putting snacks in that room for now. They just don't want to um, infection. They're worried about infection rates from snacks being in that room. You don't have to wait for face sheets at these facilities. We can always get them faxed over. And again, wear a face mask if you're in their ED at the Parkland Medical Center. I have been reassured that disinfecting the stretcher can take place. They have wipes I think you can use to disinfect your stretcher there at most of these hospitals, Parkland and Exeter. Um, Nursing homes. I mentioned earlier, we've seen virus clusters in our long-term care facilities. A lot of these nursing homes, you're going to see it anywhere you have groups of patients over the age of 65 with comorbidities such as high blood pressure, diabetes, heart disease, CHF. Um, they're all living together, grouped together in these long-term care facilities, and this virus just runs like wildfire. Right now, we have seen a uptick in at least 5 of our nursing homes with clusters of virus in them. So if you're dispatched to one of these facilities, you're going to go full bore. Goggles, face mask, gown, every patient, every time. There's also the recommendation of heading to the nurse's desk and getting instructions before going to the patient's side. Nursing homes are breeding grounds for this virus at this time. I can't stress it enough. MOLST and DNR changes. There were some emergency changes to the MOLST and DNR processes for EMTs and paramedics in advanced. The signature requirement has been dropped. So before you used to validate that the MOLST form or the Comfort Care DNR was signed by the patient. That is no longer required during the COVID state of emergency. But there must be verbal consent documented on the form, and a witness name must be documented. So you do not need a signature on the MOLST or Comfort Care DNR. So the signature requirement is gone. You don't. So as long as they have a MOLST and they've got verbal consent from the patient, you can honor the MOLST form. Just as a reminder for unprotected exposures. Unprotected exposures are considered you walked in and you didn't have a face mask on and the patient coughed in your face and you were less than 6 feet away and you suspect that they have a fever and COVID symptoms or really any type of symptoms. Could be TB. You want to immediately report the incident to the on-duty supervisor, fill out the exposure packet in full, make sure you throw the patient's name and trip number on there, fill out an incident report, letting me know what PPE was used or not used on the call and why. I don't want patient information such as, John Doe had shortness of breath and chest pain and the vital signs were this and that. That's not for this. Unprotected exposures are, I was not wearing a face mask because it fell off during patient care and the patient coughed in my face and I was less than 3 feet away and I couldn't prevent it from happening. That's what I want to know in the incident report. At this time, Sean Hunter will assess risk. So what Sean does is he takes your incident report, reads it, patient care report, reads it. We get feedback from infection control at the hospital. They let us know if the patient tested positive or not, or if they're even being tested. And we judge whether it's low, medium, or high risk. Low risk would be not wearing goggles on a call, but you wore a face mask and you wore gloves. That would be low risk. You remain at work, even if you were exposed, and we monitor you for symptoms. Medium risk would be you didn't wear a mask, and you put a mask on the patient, but you didn't wear a mask or goggles. That would be medium risk. That will put you out of work for 14 days for a COVID positive patient. High risk would be you did not wear an N95 mask and a high risk procedure was performed, such as CPR, ventilating, airway control, or nebulized medication, and you didn't wear an N95 mask. That is a big deal for a suspected COVID-19 patient for you. And you will be out of work for 14 days or until you get symptoms and are treated and then over it. But 14-day quarantine at this time for a high risk exposure. So remember, any high risk treatments that are being provided, whether they're being provided by you or somebody else, because we do work with partners such as Lowell General, and they provide high-risk patient care activities, and you are within 2 to 3 feet of the patient. So make sure you're wearing your N95 mask to protect yourself. Sean's cell is there. My cell, most people have it. My email address, any questions on any of this. It's all very important at this time.